We've heard this week that Australia has taken the unwanted title of the melanoma capital of the world. It's the second most common cancer in men in WA, the third most common in women, and you never know when you're in the clear, with rates still rising in people well into their 60s, the damage often done in their younger years. Dr. Tamara Hunter is with me now. Good afternoon, Dr. Hunter.
Hi, Tracy.
Look, we got the highest rate here. Is the message not getting through, or are there other factors at play here?
Well, melanoma is a cancer of those skin cells that give us pigmentation, the melanocytes, and it is the most aggressive form of skin cancer. I do think the message is getting through when we look at our young kids and their behaviours in the sun compared to, say, their parents or their grandparents. The problem is that we have this increasing incidence because of our ever-expanding ageing population who had a lot of sun exposure in their youth. They didn't have those safety messages, and it's now in their 60s plus that they're experiencing or developing those skin cancers.
What can be done to look out for it or catch it early, in your opinion?
Yeah, so obviously you were looking for new skin lesions, and it's certainly my suggestion, if you see something new, that you take it to your doctor to get it checked out. And they use a special A, B, C, D, E classification system. So A, asymmetry, checking the borders, the colour, the diameter of the lesion, and also is it evolving. And they can take a biopsy and then often refer you on to a specialist or dermatologist.
Is there anything that can be done to reverse sun damage that you might have exposed yourself to in your younger years?
Sadly, there's not. With skin cancers and melanomas, surgical treatment can be curative, so early detection is key. There aren't really any screening programs, formal screening programs in Australia, but there are different communities that offer them, so take advantage of those screening programs. You can even download charts from the Cancer Council, so if you're concerned about any lesions, and checking in with your GP or a dermatologist on an annual basis is a great idea.
And just important to cover up. We've got some scorching days coming up as well.
Slap all weekend.
Absolutely right. Dr. Tamara Hunter, thank you so much for your time.
Pleasure,
Have a great weekend.
Thanks.